it's an area that really cries out for greater use of telemedicine, but the infrastructure there is can be challenging. I'm sure you've dealt a lot with that. What are some of the thoughts that you have?
Yeah, I absolutely agree. I mean, the absence of technology, absence of broadband in some of these areas, absence of the right people that can do it, absence of funding. The business model doesn't make sense for funding is small. I can put a cart in a rural health in the hospital that may have 9 stroke alerts a year. Um, and so from a business standpoint, if I were to, charge that hospital a fixed fee, that hospital won't be able to afford it because they don't have enough cases. And if I were to charge them a variable fee only per case, well, when you think about it, I have so much more overhead
Right,
to
right,
carry that. And so the business model just kind of falls apart unless there is good payment structure and or unless that model gets absorbed into a bigger system. Now, the system can then absorb the costs and allocate costs to different
right,
costs and
right.
that. But that's a challenge that unless the government steps in and helps these guys. I mean, I've been to hospitals where they don't even have a clear-cut ambulances or they don't even have staff like nurses. And when there's an emergency, they call out to the community, people come in and help. I mean, that does exist. It's
Right.
it's a major issue, and really the government. I think we talked about earlier, where the government really needs to step in. I think the rural health will be at the top of the list there.